Hello, we have Jake here, who is a 17-year-old male, and he recently had a left patellar fracture, and was immobilized in a cast for about 6 weeks, and this is the first day that it's off, and that inflammation's back down, everything looks good, and today we're going to be working with him in physical therapy. So for thermotherapy, some of the indications that we would use heat for are anything subacute in that or chronic inflammation or pain stage. We'd also use it for decreased range of motion, so we want to get those tissues more extensible and moving. And then also any muscle guarding or painful trigger points or spasticity in that muscle. Some of the contraindications that we would not want to be using heat for is any active cancer in the body, any impaired mentation, which is up to the judgment of the physical therapist, Raynaud's disease, peripheral vascular disease, or any active DVTs. And those are the absolutes, I should say. And any regional is just if there's infection or recent hemorrhage in that area of the knee, and any impaired circulation or sensation in that area. And of course, if the individual is pregnant. Okay. Jake is also going to be in the proliferative stage of his healing, meaning that the body's laying down a bunch of collagen fibers right now in random orders, and our job is to kind of organize those by doing exercises with tension along those lines of stress. So, Jake, my name is Dane. I'm your physical therapist today. And I think that in order to get you moving and doing the exercises we want you to do today, I think heat would be a great thing to place on your knee to get those, get the tissue more extensible and able to get deeper range of motion while we're doing those exercises. Do you think that that is something that you'd want to try today and that we could do?
Sure.
Good. Okay, and with the heat, I'm going to be placing down a couple towels as barriers here because it will be hot. We want it to be therapeutically hot and not to the point where it's burning you. So I'll go ahead and place these down. Good. And place this here. And before I do that, I just wanted to make sure that any of the contraindications that you that we know that you don't have. So do you have Raynaud's disease by chance? Any impaired sensation or circulation in your knee?
No.
Okay, and then I was inspecting the knee, but I'm assuming there's no infection or active hemorrhage in that area?
No.
Good, okay, great. So then we're okay to put this on. Place that there. Okay, and how does that feel? That feel okay?
Mm-hmm.
Good, okay. So before I leave you, I'll just let you know what you should expect to feel. It's gonna feel warm. And if at any point it's burning you, I'm gonna give you this bell right here. Okay. If at any point you feel it's burning or too painful, just take the pack, throw it on the ground. Just get rid of it. You have my permission to do that. And then ring the bell.
Okay.
Okay. I'm gonna set a timer right here for 15 minutes.
Okay.
Put that there. And yeah, so that's gonna get going, and I will be back. Again, just feel free to just take it off if it's burning you.
Okay.
Good. Okay, Jake, how did that feel? Everything feel okay? No burns?
No, it feels really
Felt good. Great.
Mm-hmm.
Okay, so we'll go ahead and take that off now. And what I want to do is I just want to inspect the skin, make sure everything's okay. Are you okay if I touch your leg and see just how it's doing?
Mm-hmm.
Good. Okay. Looking here, everything looks nice. It's red. That means more blood flows to the area, and you should be feeling a little bit more loose as we start our exercises.